Hello, I'm Dr. Virgil May. I'm the president and the CEO of the International Commission on Healthcare Certification. I want to thank you for joining us with your time over the next 7 minutes or 8 minutes to learn more about the history of the International Commission on Healthcare Certification. Now, before we continue, I need to switch over to share screen and to open up the PowerPoint slides. So just bear with me for a few seconds while I do this. Okay, welcome. The first video on the history of the ICHCC. This is the first video in a series of about 7 videos. So please, after we finish here, check back with us occasionally to see if we've uploaded the other videos. So right now, let's get on with our history. Initially, we were incorporated in 1994 as a Commission on Disability Evaluator Certification, CDEC. We were established due to the need, the expressed need for a credential for those healthcare professionals performing disability examinations or functional capacity evaluations as well. So we created the Certified Disability Evaluator Category 1, Category 2, and Category 3. Under these categories, we certified physicians, MDs, DOs, and DCs, physical and occupational therapists, vocational evaluators, rehabilitation counselors, rehabilitation and case manager nurses. The training for this credential was administered by the National Association of Disability Professionals, better known as NADEP. Then in 1995, we received a request from the University of Florida to develop a credential for this new group of healthcare professionals that they were training in this new service delivery system called life care planning. So after completing a survey of field research of case managers practicing life care planning service delivery, we developed a certified life care planner credential. We field tested it and offered it in March of 1996. We had 2 group locations in the country, one in Atlanta, Georgia, and the other one in San Francisco, California. We had 40 candidates in Atlanta, Georgia, and we had 40 candidates in San Francisco. So we were able to administer 80 tests in those group administrations. We have awarded, as of to date, 1,800 certified life care planners and Canadian certified life care planner credentials. The ICHCC, we're very proud to say, is a primary inclusive certifying agency since our first administration of the CLCP exam 26 years ago. Healthcare professionals certified as CLCP life care planners include physicians, and again, MDs, DOs, and DCs, physician assistants, nurses, social workers, rehabilitation counselors, psychologists, licensed professional counselors, vocational rehabilitation counselors, case managers, nurse case managers, speech pathologists, physical therapists, occupational therapists, and vocational evaluators. Now, our mission statement is fairly simple: to oversee the examination of healthcare providers and professionals in the life care planning service delivery system. In order to maintain and sustain our mission, there are certain objectives that we must meet. We need to develop, review, and research standards for life care planning for postgraduate training. It is essential that the training programs that we have certified teach the same knowledge domains that we've identified in our role and function studies in the research that we've conducted there. Develop, review, and research standards of practice for life care planners. Develop and administer the CLCP, CCLCP examinations and ensure they assess the knowledge base and skill set that comprise the essential functions required of life care planners. And also, lastly, to conduct ongoing research in terms of test item validity, reliability, and identify the specific roles and functions of life care planners to ensure the CLCP and the CCLCP examinations remain current with methodology and with the required life care planning knowledge domains. To maintain our mission, there are objectives that we must meet as well that include appoint qualified CLCP, CCLCP healthcare practitioners as commissioners to the CLCP, CCLCP Board of Commissioners. Solicit the assistance of the commissioners in researching and the validity and reliability of the examination, incorporating appropriate research design and statistics. Solicit commissioners to submit their required 5 annual test items for review, revision, and/or comments for inclusion into the item pool. More on the Board of Commissioners in a later video. We will be including, as I mentioned earlier, future videos that will explain more of the ICHCC's organizational structure, credentials, qualification requirements for certification candidates, and more. Specific videos will include ICHCC organization structure, credentials and qualifying criteria, test administration and scoring standards, certification maintenance and renewal, confidentiality policy, code of professional ethics, and of course, accreditation. So please check back with our website. Go to ICHCC.org as we will be loading more of these videos in the very, very near future. Again, I thank you for attending this video, and please have a great day. And we hope to see you back again. Thank you so much.